Welcome back to our Women's Health Weekly. This is our weekly telecast where we bring experts from New York City, from Maiden Lane Medical, from around the world, from around the country, to address women's health issues from a professional, a clinical, a scientific standpoint, so that we make sure that our viewers are getting the best possible information that they can get. So I want to introduce to you a guest that I am absolutely, totally excited to have here. Dr. Carol Longroche is a gynecologic oncologist, expert in gynecologic oncology and pap smears and abnormalities associated with the cervix, uterus, reproductive tract, ovaries, fallopian tubes. So we're going to talk today about pap smears. So I'm just going to ask a bunch of questions because you can explain all this stuff to our audience a whole heck of a lot better than I can. All right, let's start with the basics. Because when we talk about pap smears, I want to know, and I want everyone to know, what is a pap smear and where is it done and how is it done?
The cervix is really just the lower part of the uterus. It's the opening to the uterus. It's the part that is accessible at the top of the vagina. So when a gynecologist examines the cervix, it's usually done with a combination of a speculum exam. And the speculum is the instrument that is inserted into the vaginal opening and that is opened slightly to reveal the outer portion, the visible part of the cervix. The cervix then extends up and really just sort of becomes one with the top of the uterine body. And the other way that the cervix is examined is during the bimanual or internal part of the exam, where the gynecologist palpates the cervix and feels for any abnormalities. So the examination is both visual and palpable. And a pap smear is when the gynecologist takes a little sample from the outside portion and the canal portion of the cervix, and those cells can then be examined by a cytologist, who is a pathologist with extra training in examination of cells, to look for any abnormalities or precancerous changes.
So somebody gets the pap smear, somebody takes the sample, packs it up, sends it off to a lab, the laboratory result comes in, and then it's communicated somehow to the patient. Okay, so we throw this term around a lot. I hear it all the time. Of course, I understand it professionally, but once again, want to hear it from the experts. 3 letters, HPV. What does that stand for? What is it? What does it mean? What does it do? Does it, drive cars and walk around, or is it something people should be worried about?
The HPV test tests for an infection called the human papillomavirus, and the HPV virus is a very common human infection. It is an infection that people acquire through sexual activity, but I think we really need to do a lot of work to destigmatize this infection because it's so common. Where it becomes very relevant is that we know that the HPV infection can, in certain people, cause precancerous changes in the cervix, and then in certain people with precancerous changes, actual invasive cervical cancer can develop from those. And so the HPV test serves as almost a flag to us as gynecologists to tell us which patients are at higher risk for developing cervical dysplasia, which is another word for precancer or cervical cancer.
So, okay, so if I'm a woman and I've been diagnosed with HPV or have been positive for HPV, does that mean I'm going to get cervical cancer?
It definitely does not. And as I mentioned before, the rates of HPV exposure and infection are very, very high in the population. More people than not have been exposed to HPV. But obviously, the rate of developing a cervical cancer is quite low. So within the group of patients that have HPV or have had HPV, some people will actually get the virus and then their bodies will clear the virus on their own. Other people will get the virus and the virus will lay dormant in the body and will not cause these precancerous and cancerous changes. But then there are people in whom the virus can be persistent, and over time that viral persistence can lead to these changes that can be harmful and dangerous. And yes, this is a problem both for men and women. Men certainly can transmit the virus to their partners, but men are also susceptible to other HPV-associated cancers like penile cancer, anal cancer, and many head and neck cancers. And so even though routine HPV testing is not a part of men's health, it is very relevant. And so for example, non-gynecologic tip, dentists will do oral cancer screenings to look for HPV-associated oral head and neck cancers for both men and women.
You said that HPV is transmitted sexually. If a woman has HPV, does that mean she also has other sexually transmitted diseases?
It does not mean that. However, a routine part of any gynecologic care is discussing with your doctor any risk factors you may have, such as a new partner, a new sexual experience, that may warrant concurrent testing for other sexually transmitted infections. And this ongoing relationship with your gynecologist will really ensure that you're getting access to all of these tests, which can really be a part of keeping people healthy.